I think the time for this legislation has come. And tonight I call on the legislature to send that bill to my desk, and I will sign it.
Governor Mills made that promise back in February. Today, Maine's Senate is poised to send the bill to her, expanding a program that says if you're going to get the chronically homeless off the streets for good, you have to start with housing first. Good evening, everyone. I'm Amanda Hill.
And I'm Chris Costa, in for Brian Yacono. That bill, LD2, would provide funding to build or acquire housing to get people experiencing chronic homelessness off the streets and help pay for services they need to stay off.
Nowhere is the homelessness crisis more evident than in Portland, where officials say more than 1,200 people are staying in city-run shelters every night. They are at capacity, including the new Homeless Services Center. But right now, more than 60% of the people staying there are asylum seekers, not the people the center was intended to help.
Of course, chronic homelessness is not just a Portland problem. It is in every corner of the state. But Portland has been an incubator site for a relatively new movement in helping people get off the streets for good. Give them the tools they need to address their mental and physical health struggles with 24/7 care available on site. But you've got to get them housing first.
I never thought in a million years I was the person that would stop and give the homeless people money. I never thought I'd be one of those people.
No one wants to live on the streets.
Well, everything here belongs to my flowers.
For almost 3 years, Kimmy Hart has been sleeping outside in Portland, wherever she can find a place to make her home.
I haven't lost it. It goes everywhere I go, because right now this is my home, you know? May not have 4 walls and a bathroom and all that, but it's my home.
The stories of how Kimmy and all her neighbors became homeless share similar themes: physical and mental health struggles, trauma, and substance use.
Some people look at you like you're an animal, like we choose this life, and I didn't choose this life.
But soon, that will change. Kimmy will be moving into her own apartment here at Florence House.
I didn't really believe it until I went to my case management worker, and he's like, it's true.
Florence House is one of 3 properties in the entire state designed to help people who are chronically homeless. The first was Logan Place, a partnership between Preble Street and Avesta Housing. It opened in 2005.
It transformed this agency in a lot of ways, where we said, okay, this is the single best solution to chronic homelessness, period.
For Preble Street Executive Director Mark Swan and his team, Logan Place was a test.
We've got to prove ourselves from many different perspectives.
Because still today, even in the shadow of Logan Place, social workers and first responders say people struggling with homelessness get stuck in a cycle.
They were bouncing from jail to shelter to sleeping outside to detox, back to jail, back to another shelter, bouncing around and not getting better. So not only were they costing all those systems money, it was tragic. It wasn't working.
Not for the unhoused, not for their caseworkers, and not for first responders.
That system, that approach, is really putting a Band-Aid on something that needs quadruple bypass surgery, right?
Public Safety Commissioner Mike Soschuk was rising through the ranks in the Portland Police Department as Logan Place opened.
And I'm like, wait a second. So you're going to put 30 of my super utilizers, people that we literally deal with every day, under one roof, and it's all going to work out just fine.
In fact, it did. Preble Street studied the effect of opening Logan Place. Those 30 tenants experienced 88% fewer nights in jail, 67% fewer emergency room visits, 81% fewer contacts with police, 66% fewer ambulance trips, 79% fewer detox program visits.
That helps law enforcement officers, that helps the neighborhoods, and that, more importantly, helps the residents that are there getting help. I mean, it's true. You hear a lot about win-win scenarios. You seldom see those. To me, this is one of those scenarios where it's incredibly, incredibly effective. I've seen it over and over and over again.
In 2010, Preble Street and Avesta partnered again, opening Florence House specifically for women. Then, in 2017, they opened Houston Commons.
Yes.
In all, 85 units.
Going down.
85 people breaking the cycle of homelessness.
Me and my mom were homeless a lot as a kid.
People like this woman, a domestic violence survivor, chronically homeless for the last 22 years.
You know, when you wake up in the morning, you first wake up and it's like thank God, okay, I'm still alive. Yeah, I've been attacked many times out there by housed people. It's part of the life and uncertainty of the things that everybody takes for granted, like a shower. You're an outcast. The community really doesn't approve of us.
She just moved into Houston Commons in April after years on the streets and 5 months on the wait list.
It saved my life.
But you was just gonna...
Saving lives and also money.
Not only look how much money we're saving, but spending what we spend better, like actually solving something.
But it's not enough.
The reality here is it's not just a City of Portland problem. A lot of that burden has come down to them.
Because people from all over the state come to Portland for services like shelters and healthcare. All the shelters, both city-run and nonprofit, are at capacity nearly every night. People are literally dying on the streets.
I've lost probably 15 people in the last month and a half have died. And that's a low number. Almost one a day dying out there. And these are my friends. I don't want them to be the next ones out there found dead.
Preble Street estimates the state needs 400 units, equivalent to 12 to 15 apartment buildings across Maine.
I think it would absolutely help. I mean, that scale, it sounds about right, but probably could even be larger when you think of the sheer numbers.
So how will the state pay for all this?
We want to be a part of that.
Avesta Housing CEO Rebecca Hatfield says there are 3 sources of funding. Maine Housing pays to actually construct the building. The Department of Housing and Urban Development pays part of the cost of rent. Then there's covering the cost of the 24/7 services.
It's the last and the most critical piece of the pie.
Why is it the most critical piece?
Because without the services, you will not see the same level of success. That's the point of this model. The idea is once they receive housing, they can then focus on the many other things in their lives that they need support with.
Tenants are required to pay 30% of their income on rent, skin in the game, to keep this housing and improve themselves. Though, tenants are not required to be sober.
Well, you're still allowing them to use drugs or alcohol. Why is that low barrier been helpful in the cases you've explained?
I think that once you stabilize somebody in an atmosphere, then you can work on a lot of these other things that is going to have a negative impact on their world, whether it's substance use disorders, stabilizing them on their medication from a mental health standpoint, the co-occurring aspects of that. You can work on the trauma that they had when they were a child that led to these things, that led to the behavioral health issue. But I would argue it's easy to say that it's difficult to do that and then be, hey, this is great, we had a good counseling session. Now go live in your tent in the swamp out behind the county jail, and then we'll see you in 2 days. This is going to be great. Thank you very much for being open. Right? Just saying that out loud doesn't make a lot of sense. And the reality is, when you see that on the street real time, it does not work.
I still use crack cocaine. I use it for emotional pain. Maybe that'll happen once I get housed. You know, maybe I won't need it anymore.
Making housing first, a critical first step to help people like Kimmy start fresh.
And everybody down here is so happy for me. You know, they don't feel angry. They're like, Kim, you need this, you deserve it. You've been through, you walked through hell and you came up the other side.
And so just a quick point of clarification, tenants are not allowed to use illegal drugs. They still follow the same rules and laws that everybody else does. So what's next? There are 2 pieces of legislation that would establish the Housing First program under Maine's Department of Health and Human Services. LD2 faces more votes. It passed in the House and now is on the special appropriations table in the Senate, awaiting funding. The other avenue is incorporated as part of Governor Janet Mills' change package as part of the state budget. Only one of these can be implemented. And one more note. Last night, the Portland City Council postponed a vote on the city's proposed $261 million budget because city leaders want to see if the state will help pay for the increase in general assistance that the city is providing to the new asylum seekers. A bill that would do that, LD 1664, is yet to make it out of committee.